Chapter 16, Pathology Behavior Disorders. Defining behavior disorders is very difficult. We must be very careful in psychiatry to avoid trying to alter behavior per se. To say so may sound very puzzling. You ask, but surely it is the behavior which presents itself? You would be perfectly correct. So, am I contradicting myself? No. I most certainly am not. Psychiatry regards behavior in the same way that a physician regards temperature. Both are symptoms. They are not illnesses in themselves. The difference between behavior and temperature is that if you have a temperature, you are probably sick. Behavior disturbances have to also include either a disturbance in thoughts or feelings, which are causing this behavior, before the behavior is deemed an illness. We see a loosening of this rigid definition when we talk about personality disorder. If you remember, we said the difference between illnesses and personality disorders are that in illnesses we see a change in functioning. All the same, it is important that we realize that, at the fringes of the realms of psychiatry, there does exist an entity known as behavioral disorders. What is a behavioral disorder? Generally speaking, behavior disorders result from the combination of both nurture and stimulus. The resulting behavior is judged according to social mores and, of most importance, society defines social mores, that is, what is acceptable and unacceptable. Social mores change. Romeo and Juliet would be considered juvenile sex offenders today. Imagine what would happen to Romeo when he started his infatuation? Oscar Wilde would not have gone to prison. Vladimir Nabokov, the author of Lolita, most probably would. The behavior would be defined as a behavior disorder, merely by the parameter of which year they were born. We all have behavioral traits. Who has not been shy, wet the bed or feared heights? In medicine, we tend to observe phenomena in two ways. It exists or it does not. The second way is to categorize the range of the phenomena as amplitude or percentage and placing it on the bell curve representing all known values. Not everyone's temperature is below 37.0 degrees Celsius if you measure people perfectly well. Some are approaching 37.0 with no help from a virus. I have a very low temperature. At 36.7 degrees Celsius, I start to feel the effects. Others feel at 37.2 degrees. This unusually low temperature can be useful. At school, I'd get out of anything I wanted. I told the school nurse I felt unwell. Out came the thermometer and I was declared ill and sent home. I wonder what Nurse Dalton would say to that? She would probably box my ears. We did say that if someone changes, he is ill. We did say if someone's development is different, they may well develop a personality disorder. But, if this is how the person behaves in a certain way and a fickle society is not happy about it, then behavior disorders are deemed to be. In my opinion, a lot of the so-called neuroses such as shyness, or bedwetting are, in fact, behavioral disorders. They are part of a spectrum. Being unhappy or different is not an illness. In other words, behavior disorders, whilst being unwanted sometimes are not caused, either directly or indirectly, by the personality or by an illness. Behavior disorders very often will stop occurring when the person is removed from the environment which accepts or tolerates, or even encourages, the behavioral aspects. As we develop as a child, we make or have tics. There are two options. The unusual behavior may cause anxiety due to others' reaction and become embedded in a modified form of neurotic behavior. The other alternative is that the behavior becomes accepted, in part, as what is expected from you. In the family circumstances, this may mean that your particular role in the family allows you or expects you to behave in a certain manner. When removed from this particular environment, you seem to behave this way. In other words, the way we are expected to behave is the way we probably will behave. Far more important is that we will incorporate these expectations into our own expectations, and they all sink into the automatic behavior section. This has quite amazing consequences. Religions and beliefs allow us and expect us to behave in certain ways. Belonging to this sect or religion or that sect or religion allows us to discriminate or to behave quite differently than we would if we were considering ourselves as an individual and not part of the sect. We behave differently in a football crowd. We behave differently as we adopt religious beliefs. We behave differently when we are thinking in political terms. We aspire to the groupthink in our political behavior and expectations. Even more surprising, behavior can vary just the same as personality disorders. We have seen that there are different notes on the piano. The simile we used in personality is usable in describing national behavior. We see, or expect to see, accentuation of certain characteristics. We expect Germans to behave differently from Italians. We expect Israelis' sex to behave differently from Palestinians. Again, all these expectations and behavioral patterns become part of the automatic everything. We almost never question them. In fact, it can be quite problematic if we do. One of the important things in our survival mode is to belong to a group which will help us exist. I am a very social, political animal, taking particular interest in local politics. As I pointed out before, as part of an evolutionary necessity, we vote and generally relate to our leaders emotionally and not cognitively. It has always fascinated me that, in elections at the local level, we are always talking about quality of life. No one has a real clue what it is. It is a catch-all situation where the community will feel at one with itself. In the election, we evoke the concept on an emotional level. Then we hate or love our candidates accordingly. But, we take every attribute and color it positively or negatively according to our gut feeling, steadfast and boring, dynamic and reckless, single-minded and headstrong, bulldozer and tyrant. Having gotten this far, permit me to wander off subject a little. It is related to behavior, communal behavior. I believe that quality of life is the ability to identify with, to be proud of and to be involved in communal activity. Pride and belonging are essential components in what we define as quality of life. Please do not confuse this with quality of surroundings. Of course, we want our environment to be nice and pleasant, but more than anything else, we want to belong to something that we feel we belong to. It's easier to see you protected and part of something which is pleasant to be part of. The downside is that we readily accept collective behavioral aspects of our community and put it into the automatic everything without ever questioning it, because it is far too convenient not to. As an example, Ornat, my village, was involved in a political discussion to unite with other villages and become a larger municipality. The gut feeling was that we should not. But, the debate was emotional and involved them and us, mostly in terms which were neither wrong or irrelevant. The gut feeling was to avoid change. We studiously avoided any discussion about real monetary and managerial issues. In the words of one famous Israeli political, La Passionara, whilst in full flight turned to a heckler saying, "Do not confuse me with facts." To belong to the Ornat herd, you had to accept something without question where there were many questions, which were left unasked, never mind unanswered. Back to behavior disorders. Remember always, we can only observe behavior when the person is with somebody else. When we are on our own, generally speaking, we do not exhibit any behavioral disturbances. Sometimes, it's difficult in an interview situation to assess any possible behavioral disturbances because our subject is not in an environment where they may exhibit the disturbance. There are certain kinds of environments where a disturbance in one may precipitate or exacerbate a disturbance in the other. Let us have a look at some examples. One common example I have noticed often is that a so-called infidelity matches neatly with his partner's suspicions. It is as if the couple between them are vindicating the pathology of one. I am not making excuses for infidelity, but in my opinion, infidelity is often one partner acting out the pathology of the other partner. Here the partners are acting out the other's neuroses or personality disorder. This two-to-tango effect can become more sinister. There is one common pathology called folie à deux. Sometimes, when we have a paranoid psychosis, we can find that a member of the family accepts, as a belief, the paranoid ideation and relates to it as if it were reality. Of course, the family will react to any debilitating psychiatric illnesses in different ways. I do not think this should be deemed to be some kind of behavioral disorder, but it is a distinct behavior. In my experience, it is interesting that the families of PTSD patients tend not only to grow up with heightened anxiety, they possess all the hallmarks of restrictive parentage. They have something else. A lot of them behave as if their life is scripted for them to be traumatized too. We see this preordained generation by generation behavior in the traumatized and sexually abused child. They far too often grow up to be traumatizing and abusive. Israeli obsession with the Holocaust is part of the Israeli behavior. To give an insight from my experience, 25 years ago if you asked a teenager, "Can it happen again?" Mainly children of survivors said, "Definitely, yes." The rest said no. Now, the answer is nigh on a universal yes. As an unabashed Israeli, I allow myself to ask you, my reader, how do you explain that? Another interesting dyad of illness, behavior disorder, is the wife of the alcoholic. We know that alcoholism is an illness of addiction. We do know that if an alcoholic reforms, then the marriage may disintegrate. Why the partner copes with the addiction, but not the cessation, is open to speculation. There are two kinds of interesting personality mixes. They both involve how certain kinds of characters or personalities behave in the presence of the psychopath. The psychopath, as you may remember, is someone who has grown up without the ability to feel what is wrong. It is as if they are devoid of the ability to feel anxiety and they cannot feel what is wrong. The intelligent and sophisticated psychopath is able to learn and know that something is wrong, yet, does not feel it. Imagine it as a kind of moral color blindness. They know they're a color red, but they cannot see it. A psychopath with this absence of an ability to imagine what is right and what is wrong was first described as moral insanity. This is a brilliant description because morally, these people are quite insane. When the psychopath meets up with the sociopath, the combination is explosive. The controlled but amoral psychopath can plan and execute some amazingly antisocial acts. The sociopath is completely uncontrolled, and like the psychopath, for completely different reasons, has no conscience to stop him from doing horrendous acts. The psychopath is often the brains, and the sociopath is often the executor. When together, they commit some very atrocious crimes. Another strangely corrosive mixture is the psychopath and obsessive personality. When a psychopath achieves a position of power and is in a power structure where those underneath follow orders, there can be trouble. If those following orders have obsessive traits, in other words, they behave automatically, fulfilling the orders as they should be, they are liable to fulfill the orders without question. They are orders. As I stated before, I believe there are national traits which highlight certain attributes, and I believe that the Germanic trait to be well-disciplined, when mixed with the psychopathic paranoid behavior of Hitler, led to or certainly contributed to a very, very dark period in mankind's history and in particular, the Jewish history. There are other examples I have read. 1. An explanation of Watergate. While I do not believe we should psychobabble everything, sometimes we can give explanations or insights. One explanation I read was that the hierarchy in the Nixon administration had psychopathic traits, whereas the executors were simply obsessively following orders. When the followers were removed from the environment, similarly to Folie à Deux, the non-pathological member saw the light. Namely, the underlings in this case were bewildered at how they managed to carry out acts which they now realized were criminal, and yet, in the environment they were in, seemed to be justified. Psychiatry has to be very, very aware of what it is aligning itself with discussing behavior. As a profession, we aided both Nazis and the Soviet Russians to progress with nefarious and disgusting schemes. That was not a momentarily passing phenomena. We deemed homosexual behavior as an illness treatable by leucotomy or ECT. There is a phrase in Hebrew saying that you can have both nits and lice, which means it does not have to be either one or the other pathology or disturbance. Very often, we see behavioral disturbances in the mentally ill. But the mental illness is not that which is causing the disturbance in behavior. The same backdrop which caused the damage and bruised ego to fracture will also imbibe an inherent atmosphere where adaptive behavior will not be learnt. Knits a story. I worked in a hostel where patients who were supposedly not mentally ill had severe behavioral disturbances. They were often vicious and violent. When examining the history closely, many of them were indeed psychotic, but because of the behavioral disturbance, the people who diagnosed them, the psychiatrists, preferred seeing them in the institution for behavioral disturbances and not treating psychiatric illnesses. In my opinion, this was legitimate because another example of the behavioral disturbance was the leading symptom. However, once in the hostel, they were bombarded with antipsychotics as if that psychosis was the only pathology. The underlying principle was that if the drug didn't work, this is a reason to give more or something else. All the patients were exhibiting dreadful side effects of drugs which were bombing them into an ape-like drooling oblivion. One such lady was beyond any ability to converse with. Her behavior was bizarre. She would shave her head or half of it. She refused to communicate. She would fall about and crawl all over the floor. She was taking enough medications to stock a pharmacy on her own. In despair, I stopped the medication saying, if they didn't help, why give them? Then something amazing happened. The lady became perfectly normal, communicative, smiling, and just very sweet. When telling my colleagues, they reassured me that it was just a matter of time before I would see the psychosis crawl out of the woodwork. Sure enough, after about 2 weeks I was greeted by the nurse telling me that our patient was behaving very differently. She was smiling and nobody really knew why. It was a sign she was hallucinating. I examined her together with her social worker. Nitsa told me that she was smiling because she was a singer. Of course, I assumed these were delusions until I looked at the social worker who sheepishly nodded and affirmed that it was true. I asked her why she was smiling, and Nitsa said she remembered the crowds and how good it felt to hear the applause. Forewarned is forearmed. This time, I glanced at the social worker and she nodded again. I asked Nitsa to sing for us. She had the voice of an angel. We discharged her to another hostel. We made them promise that Nitsa would never be given any more medication, no matter what. The moral of the story and the chapter is to accept nothing when dealing with behavior. Always ask questions, mainly to yourself about what your role is and who are you serving, and far more important, we are part of a groupthink with regard to medications. I think we should summarize this section on pathology before explaining how I believe therapy can work.